among the more common injuries for sports across the board is ankle injury. An ankle injury can be anything from a minor sprain to a severe sprain to an ankle fracture, or even just sort of a chronic irritating tendonitis around the ankle that's just enough to cause a decrease in strength or a decrease in performance. The treatment is going to differ depending on the extent of the injury and the type of injury. But with our football players, our soccer players, our athletes who do a lot of jumping, like the basketball players, volleyball players, if they come down on that ankle just slightly the wrong way, something's got to give, and a lot of times it'll be a ligament, or sometimes, unfortunately, even the bone. The initial key is to recognize the injury and diagnose it appropriately. The next key is to convince the athlete and the athlete's family that this is an injury that needs to be treated. Sometimes you find yourself needing to help the athlete overcome the mentality that, oh, it's just a sprain, I'll tough it out. If those ligament injuries aren't treated appropriately, they can go on to long-term problems that can cause long-term pain, long-term swelling, long-term instability of the joint. Initially, you want to combat the inflammation, rest the joint, protect it, immobilize it, ice and elevation, anti-inflammatory medications. And then the next phase is strengthening and rehabilitation. If I or one of our representatives from CAMC aren't there on the sideline or at the actual game, then we're basically available 24/7, and the coaches and the trainers have our contact information, and those student athletes get processed right away. So it's an expedited process, and we try to, a lot of times with any sort of injury, timing of the treatment is almost as important as the actual treatment itself.